So ma'am, infertility ki sambandhinchi, how much of the percentage do you think is organic and how much of that is stress related in the current scenario?
Rather than a specialist, I'll talk about fertility center. Fertility center అనగానే IVF అనుకుంటారు. Fertility is pregnancy, giving them a baby. పిల్లలు కాకపోతే ఆమెను ఎట్లా వదిలేస్తారు? పిల్లలు కదా వదలాలి. Kids are a part of your life. Kids are not life. Most often it's the fear of నాది తప్ప నీది తప్ప. Again, it's a joint work.
One thing men should stop immediately.
Smoking. Smoking is a very big impact on the quality of the sperm. Stress for both.
Emerging social media also, ma'am, is misleading couples who are trying for natural method or IVF. I mean, they are immediately driving towards tests and then they are seeing the doctor. Even before they see doctor, they undergo tests.
Some people say, I want to know how to move further from this. Some people say, I want a natural pregnancy, whatever may happen. Some people say, I just want to get pregnant quickly. But having said that, papam janalu kuda teliyadu kada evaru nammal evaru nammaddu. Can't blame them also.
India lo for IVF centers regulate cheyadaniki laws inka strict avvali ani meer anukuntaru ma'am. What is your take on that?
License undali and equipment kaani, layout kaani, qualification kaani, there are standards.
ఇప్పుడు ఎగ్ బ్యాంక్స్ అనేవి వస్తున్నాయి కదా, చాలా పాపులర్ అయిపోయింది.
The maximum peak is in 20 to 25 and after that 25 to 30 is a small drop, 30 to 35 is a big drop, after 35 it's a steep decline. Once we find out, then I'll tell you what are the ways of getting pregnant and the success rate with each method, but don't try to go for IVF. Meer IVF చేయించమంటే నాకు డబ్బులు వస్తాయి, but you are not here to give me money, you are here to take a baby. Rather than saying నీకు eggs రావు, ఇంకా నీ దగ్గర eggs లేవు, you can't mother a baby with your eggs. No, just find out. You will find an answer. And they had 4 failed miscarriages, 4 failed IVFs, and they got pregnant.
One fertility myth you want to ban permanently.
Women is responsible for fertility.
Tea or coffee during IVF?
Tea is okay. Coffee has caffeine, which can have effect on the sperm and egg quality. Teas are okay.
One food couples overrate for fertility?
Whatever they see on the reels, ittinta mulakadlu antaru, dates antaru.
Most googled fertility misconception?
Food, I think. Fertility foods,
One thing women should stop stressing about?
I want to get pregnant next month. Just leave it. Do your hard work and then rest will follow.
Natural conception or IVF, which is more misunderstood?
IVF. వాళ్ళు అంటున్నారంటే తప్పు కాదుకోవద్దు. వాళ్ళకేం కావాలి, మనోడు మనోళ్ళకి తప్పు కాదు. ఆతృతలు ఏదో ఒకటి అడిగారు అనుకోండి, అది ప్రెషర్ తీసుకోకండి. ఇట్స్ ఇన్ యువర్ హ్యాండ్స్ టు టేక్ ఇట్ as a pressure or think it's a desire. మీతో పాటు దే ఆల్సో వాంట్ యూ టు హ్యావ్ అ చైల్డ్ అండ్ యు ఆర్ సేమ్ పార్టీ అనుకోండి, యూ విల్ బి రిలీవ్డ్.
తెలుగు టైమ్స్ ప్రేక్షకులందరికీ నమస్కారం అండి. ఐఎమ్ డాక్టర్ స్నేహ, కన్సల్టెంట్ హిస్టోపెథాలజిస్ట్, యశోద హాస్పిటల్, హైటెక్ సిటీ. ఇవాళ మనతో ఉన్న గెస్ట్ అండి, షీ ఇస్ ద మోస్ట్ రెస్పెక్టెడ్ పర్సన్ ఇన్ ద ఫీల్డ్ ఆఫ్ ఫర్టిలిటీ మెడిసిన్. Her name is not only famous in whole of Hyderabad but also whole of South India. She is none other than Dr. Narmada Katakam, madam. Welcome to the podcast, ma'am.
Thank you.
So, ma'am, in the year 1994, MBBS Osmania Medical College lo join ayi, tarvata 2000 lo MD Obstetrics and Gynaecology subject from Osmania Medical College finish chesi, tarvata UK ki velli 13 years UK lo practice చూసి లేటెస్ట్ ఏంటి అడ్వాన్స్మెంట్స్ అన్ని నేర్చుకుని, and she wanted to give her services to the homeland and she came back again and she established Genesis Hospitals. So she heads Genesis Hospitals. In the year 2017 first facility established చేశారండి హైదరాబాద్ లో, కొత్తపేటలో, and thereon there is no looking back. ఒకటి తర్వాత ఒకటి 3 hospitals పెట్టారు and she is continuously successfully running all the 3 facilities till date. So ma'am, I think we are honored to have you on the podcast today. We are very much thankful to you, ma'am, for giving your time and thinking of sharing your valuable insights on this field of fertility medicine with all our viewers today. So ma'am, before we start talking about the fertility medicine, I just wanted to ask you, how did you first thought of becoming a doctor, ma'am? Like, who was your inspiration to drive into this side?
Honestly, I sometimes feel it's unbelievable, but when I was 2.5, I used to go with my mother. Then she used to go to a gynecology checkups. And I used to look at that lady thinking, oh my God, what an aura.
Okay.
And that time, without knowing the spelling of gynecologist, I thought I wanted to be a doctor.
Okay.
And God has been so kind.
Your mother is also doctor, ma'am, gynecologist.
No, my mother is a housewife.
Oh, okay.
Yeah, I used to go to her. I used to go along with her when she used to take me to the doctor.
Okay.
I didn't go to any of the hospitals, but that was one place and very first visit. So I have such a clear, vivid memory of that moment. I felt I should be a doctor like her.
So parents are not doctors, ma'am?
No parents. No, I'm the doctor
in the family.
In the family, and the doctor name who inspired me was called Dr. Alaknanda.
Okay.
It's in a place called Filkana in Old City of Hyderabad. Can't forget her anytime.
Nice, ma'am. Then OBG, ma'am, that was also your subject of choice.
That's it.
Inspiration.
I don't even know how to reach to that gynecology and obstetrics. But as age advanced, I figured out that I should do medicine, then I should sit for entrance, and it's very competitive. All girls choose gynecology and obstetrics only, and I had to compete with them.
Yeah.
And here I am.
So great, ma'am. Ante family of doctors నుంచి వచ్చిన వాళ్ళకు ఒక బేస్ ఉంటుంది, అక్కడ నుంచి ఇంకా పైకి వెళ్ళాలంటే వాళ్ళు ఈజీగా రీచ్ అవుతారు అనుకుంటారు కదా మ్యామ్. బట్ కమింగ్ ఫ్రమ్ నో ఫ్యామిలీ బ్యాక్గ్రౌండ్ ఆఫ్ డాక్టర్స్, యూ ఎస్టాబ్లిష్డ్ యువర్ సెల్ఫ్ అండ్ యూ ఆర్ నౌ the beacon of light in the field of fertility medicine is like very inspiring, ma'am, to all the people who are aspiring to become like establish themselves and to give their services to their fellow beings. It's like
it's quite rewarding in a way to be self-made. I know it's hard work. I don't know, without hard work it's much easier, but it's quite rewarding.
Yeah, ma'am. మ్యామ్ ఫర్టిలిటీ మెడిసిన్ లో ఫెలోషిప్స్ చేసి యూకే లో మళ్ళీ వెనక్కి రావడానికి రీజన్ ఏంటి మ్యామ్? ఐ మీన్ మోస్ట్ ఆఫ్ దెమ్ అక్కడికి వెళ్ళిపోతే అక్కడే సెటిల్ అవుతారు కదా మ్యామ్. ఐ మీన్ వాట్ వాస్ దట్ వన్ డ్రాయింగ్ ఫ్యాక్టర్ ఫర్ యూ టు కమ్ బ్యాక్?
I had a very strong anchor left in India. My husband never joined us. So I went with my kids once they finished schooling and went to university. I stayed there till both of them went to university, and then I returned back. My husband actually wanted to join us. He came twice to take the exams, but he didn't want to leave the own hospital, own setup, and be working under someone as a junior to ascend up. So he was only a visitor whenever we were there. So I just came back.
మ్యామ్ వెనక్కి వచ్చాక కూడా చాలా మంది దే మైట్ హ్యావ్ ఆఫర్డ్ యూ విత్ గుడ్ ఆఫర్స్, మీరు ఇక్కడ జాయిన్ అవుతే బాగా క్యాంపెయిన్ చేసి బాగా అలా కాకుండా యూ వాంటెడ్ టు ఎస్టాబ్లిష్ యువర్ ఓన్ హాస్పిటల్ ఫెసిలిటీ అండ్ దెన్ యూ వాంటెడ్ టు డూ ఇట్ బై యువర్ సెల్ఫ్. అది కొంచెం I mean, it takes courage to do such things, no ma'am, definitely. And also you need to prove it. Pettin tarvat melli ventane raakpena koncham immediate ga raakpena ane dhairyamto pettali. But then pettina 2 years lone you have received many prestigious awards also for the Genesis First Lady Center. I know there are many, like the Times group has felicitated with best emerging hospital clinic in the year 2019, 2 years immediately after establishing the facility. So what has driven you, ma'am, to establish your own setup?
So training in UK, I'd always cherish and respect the training I got, because like all of us when I practiced in India, worked in India, I loved the place where I'm trained. I was postgraduate in Sultan Bazar Hospital. I loved the amount of work, the training and the teaching I got. What I realized after going to UK, what we write in the exams, what we offer to the patient, something is here, something is very, very different. One thing in UK, you don't need to think about or recite what you need to do for that patient. Exactly what is prescribed happens to the patient. The investigations, the management, the stepwise treatment. So I got trained and I really, really liked that. That suited my personality a lot. And after coming back, the last thing I wanted to do was start my own hospital. I didn't want that jhanjat at all. So I wanted to have a clinic and then go and do my cases, and I visited few places. That wasn't what I wanted to do. That wasn't what I wanted to offer. So I thought, if I want something which I like and to maintain the standards of learning in the UK, I have to do the hard work and establish myself. So that's how Genesis Fertility and Laparoscopy Center started. That was the first branch in 2017 in Kottapet. So we lived around that area, and I wanted to be close to home. Even now when I started branches, I always look for the consultants stay close to the home so that they don't need to travel. So that was the beginning of Genesis, that's the birth of Genesis.
I think that is the best thing you have done. Now many people, thousands of lives I think are benefited by coming to Genesis Fertility Center and
God is kind.
Enjoying the parenthood. Yeah, that's amazing, ma'am. So ma'am, I think I would like to ask you one question, ma'am. So was there any one patient or a moment that emotionally changed you, ma'am?
I'm quite emotionally distant person.
Okay.
I'm always like plan, execute.
Yeah.
I don't know if it works in my favor or not, but it's always about doing systematically, doing structurally, and then execute what is the best. I wouldn't say emotionally, but I do remember some patient stories and how it changed. And 2 days ago on Instagram, one of the patients texted me with her baby's pictures. One is 7 years old, one is 6 years old. In the first year of me returning to India, she came very sobbing, very emotional, and mother and daughter came. I was worried if they're going to tell me that they have cancer. No, it was only endometrioma.
Okay.
And then they were so worried. Obviously, I cannot say endometrioma because if the patient is upset, patient is influenced by it. It is.
Yeah.
So I saw her, I scanned her, arranged investigations, operated her. And then I told her, I'll give you medication for another month. And after that, when you get a period, come back to me. I'll do the pregnancy planning. She came back to me 2 months later. Madam, inka period ravatledu. Meer period vachin tarvata rammannaru. She was pregnant.
Oh, nice.
So these kind of stories really make me happy. Otherwise, the pregnancy journey is stressful when, especially when women with endometriosis. So when she texted me, those are like happy moments. Thinking, oh, they still remember us.
True. Yeah. OBG is one setup wherein you will always deal with happy patients. Once after delivery, they'll come with sweet boxes and all. But this infertility is a field wherein you'll always see sad faces most of the time because they're still expecting and they are in that trial of becoming parents, but they are failing. And ma'am, but still you chose this only, but still you'll maintain your sanity. Most of the times you are really energetic, smiling, giving hope to your patients all the time. How do you balance this, ma'am?
I actually really loved obstetrics and emergency obstetrics. I used to lead labor ward and I used to do a lot of emergency drills and training. And it was my passion. And then it was 3-4 years before planning to return. And I was telling my husband, I'll come and start a very high dependency unit with UK standards. We can treat a lot of women who are at high risk and all. He said, India changed a lot. India is not what it used to be for doctors when you left. There used to be respect, there used to be sanity, there used to be, it's different.
True.
And then probably that was the time when I left UK, the corporate sectors were coming in and then it's full-blown corporate now. People who are doctors having their own setups, probably it's a small fraction.
Yes.
So common people do not differentiate a hospital, a business and a doctor.
True.
And he said, no, obstetrics is not something you should even think about doing. Then I started thinking about fertility. Fertility is like you love it or you hate it because it's so in depth, so detailed. And as you said, you don't hand over a baby. 50% of the times you hand over bad news. 60% of the times you hand over bad news. How do I balance? As I said, I think systematically, very organized, and I tell them what's the success rate. Despite of whatever I say, they can still have not realistic expectations, but my job is to create realistic expectations. My job is not to make false promises. My job is not to give them very high hope and make them fall into the cliff.
By being that open and that genuine, some patients will even eventually go to see another doctor. They'll not come to see you again. That risk is also there.
I don't mind.
People will not.
I absolutely don't mind.
Exactly.
I absolutely don't mind. I say it and I give it in writing. And sometimes I tell them, if somebody promises you 80-90%, worldwide that success rate is not there. I don't mind wherever you go, but do not believe those numbers.
Exactly. I think the emerging social media also, ma'am, is misleading couples who are trying for natural method or IVF. I mean, they are immediately driving towards tests and then they are seeing the doctor. Even before they see doctor, they undergo tests. Just by seeing Google or ChatGPT or whatever. So this is definitely not information mal failure, or what is it, ma'am? How do you deal with such patients who come to you with their own set of reports and they ask you what to do?
I don't know if you observed, I noticed a lot of people getting a lot of investigations done from COVID time. That's when a lot of diagnostic center and a lot of big packages started. They come with a bunch of 50 investigation pages where there are nutrients, micronutrients or elements which we didn't even see or read when we were doing undergrad. Probably you do a lot more as being a pathologist, but being a gynecologist, whatever we learned in microbiology, biochemistry, there's so many test reports and there will always be a bold letter. And then they panic about it, they Google it. So if they want a magnifying lens to look into their life, they can be their own guest. But I look at when they come with those reports, I also understand they got their reports, which means they read about it, and they might have looked at the results as well.
Yes.
Usually, my opening questions to the couple who come to see me is, what are you expecting from this consultation? So I create a baseline of what they want. Some people say, I want to know what is the problem. Some people say, I want to know how to move further from this. Some people say, I want a natural pregnancy, whatever may happen. Some people say, I just want to get pregnant quickly. That opening question helps me so much to understand. I don't want them to be on my way. I just want to understand what they want and help their way to reach their destination. So they can come with old files. You know what? Some people hide the files. That is the funniest thing. They can't test my knowledge. It's their background, it's their past they need to show me. So whatever information they give, I start from there. If they don't give me that information, I have to repeat all that.
Yeah, true.
So
it's their loss.
Yeah,
true.
But you know what? I love my practice. So many different mentalities, so many ways to understand people, so many couple interactions, so much of influence of family, neighbors, every consultation. I find it so interesting. It's like thinking, oh, ila kuda alochistara janalu, oh, ila alochinchala, ila matladala. There's always so much learning and understanding.
You're very welcoming to all the perceptions, ma'am. Perspectives nunchi meeru oka patient ni treat cheyadam. It takes a lot of patience to handle that type of cases also.
I think I have two different sides of it. If it's about them, I'm fully about them. Only when it comes to the science and execution of whatever investigations and process, then I'm very scientific. But apart from that, because there's one way to treat it, but that might be expensive. And they can't afford. And sometimes the staff thinking, either treatment kaval kada vallaki vallu enduku odantunnaru. We don't know. We don't know it's the myth. We don't know it's the financial. We don't know it's the support of the family. We don't know it's support of each other. Always
మరి ఎక్కువ మూఢనమ్మకాలు కూడా ఉంటాయి కదా మ్యామ్ ఈ ఫర్టిలిటీకి సంబంధించి. సో వాళ్ళు ఇటువైపు ఈ టైం కి వెళ్తే వీళ్ళతో ఈ పేరుతో స్టార్ట్ అయిన వాళ్ళతో వాళ్ళ దగ్గరికి వెళ్తే ఆ లెవెల్ వరకు కూడా ఉన్నాయి కదా మ్యామ్ ఇంకా. సో డీలింగ్ విత్ సచ్ టైప్ ఆఫ్ థింగ్స్ ఇస్ లైక్ వెరీ టఫ్, బట్ యూ డీల్ ఇట్ విత్ అ స్మైల్.
Accept it. Makes it so easy. You want to fight it, you want to change it, then you'll struggle. Accept it. Is it bothering you? No. Is it changing your practice? No. Is it going to influence you? No. Accept it. Let them be like the way. I think I use this principle in life as well. If they want it, let them be. As long as it doesn't influence or harm us. People can be the way they want.
Exactly, ma'am. So 13 years UK kelli international standards ఏంటి, లేటెస్ట్ ఏ స్టాండర్డ్ లో ట్రీట్మెంట్ ఇస్తున్నారు అని తెలుసుకొని వచ్చిన డాక్టర్స్ ని మనం నమ్మడానికి వెనకాడతామండి. బట్ మనం వేరే ఎవరు ఏ బేసిస్ లేకుండా ఏ సర్టిఫికేషన్ లేకుండా మీరు ఇది చేయండి మీకు 6 నెలల్లో పిల్లలు పుడతారు అని చెప్పిన వాళ్ళని నమ్మడానికి మాత్రం ఇష్టపడతాం. ఐ థింక్ ఇలాంటి విషయాలకి హార్ట్ కి తీసుకోకుండా మేడం ఇప్పుడు ఇంకా వాళ్ళ ఇష్టం, వాళ్ళు తెలుసుకున్నప్పుడు చేసుకుంటారు అని చేసుకుంటున్నారు. కాబట్టి మామ్ కూడా హ్యాపీగా ఉంటూ నమ్మి వచ్చిన పేషెంట్స్ కి న్యాయం చేస్తూ అలా ముందుకు వెళ్తున్నారు. ఐ థింక్ దట్ ఈస్ వన్ వెరీ బ్యూటిఫుల్ థింగ్ అబౌట్ యూ మ్యామ్. ఐ మీన్ whatever you can do 100% మీరు నమ్మిన వాళ్ళకి ఇస్తున్నారు. నమ్మిన వాళ్ళని కన్విన్స్ చేయడం is not your job. You're leaving
and also I don't obviously no doctor can expect every patient to come to them. We can't even handle.
That's true.
And వచ్చిన వాళ్ళు నమ్మిన వాళ్ళు చేయడానికి, because what I noticed in all the patients who come, there are some couples who come with 100 doubts. 100 doubts about the problem, acceptable. 100 doubts about what will happen here. వాళ్ళకే స్ట్రెస్, వాళ్ళకే కార్టిసాల్ పెరుగుద్ది, వాళ్ళకే సక్సెస్ రేట్ తగ్గుద్ది. కొంతమంది ఏమో దిస్ నో సైంటిఫిక్ ఎవిడెన్స్, బట్ ఏం చేసినా సరే మీ ఇష్టం వచ్చింది చేయండి అని. ఆబ్వియస్లీ ఐ స్టిల్ explain the science and what I'm doing and all. The success rate is so high in them. I think the positive energy and the peace just balances all the hormones.
ఏ డౌట్స్ లేకుండా నమ్మితే ప్రొసీజర్ కూడా క్లిక్ అయ్యే ఛాన్సెస్
ఎక్కువ. బట్ హ్యావింగ్ సెడ్ దట్, పాపం జనాలు కూడా తెలియదు కదా ఎవరు నమ్మాలి ఎవరు నమ్మద్దు. We can't blame them also, because there's so many, as you said, there's so many people with 3 days course attend చేసి fertility center, 5 days course attend చేసి fertility center, ఏమీ లేకుండా వేరే వాళ్ళ పేరుతో లైసెన్స్ చేసి రకరకాల ప్రాక్టీషనర్స్ ఉన్నప్పుడు వాళ్ళకు కూడా తెలియదు.
దట్ బ్రింగ్స్ మీ టు దిస్ క్వశ్చన్ మ్యామ్. ఇండియాలో IVF సెంటర్స్ రెగ్యులేట్ చేయడానికి లాస్ ఇంకా స్ట్రిక్ట్ అవ్వాలి అని మీరు అనుకుంటున్నారు మ్యామ్. వాట్ ఈస్ యువర్ టేక్ ఆన్ దట్?
So there's something called HFEA, Human Fertilization Embryology Authority in UK. So when I came, I used to follow all their guidelines and the forms also, even though we didn't have any law to guide us. But that gave me comfort that I'm explaining everything and I'm documenting everything. And then comes ART law in 2021. Probably British Rajamlo chala copy chesinattu, most of the points are very similar to HFEA law. So for me, transition from my old practice when the ART law came 4 years after I started practice was very, very smooth. I only needed to change the heading. Most of the content was same. ఒక విధంగా చూస్తే లైసెన్స్ ఉండాలి అండ్ ఎక్విప్మెంట్ కానీ లేఅవుట్ కానీ క్వాలిఫికేషన్ కానీ there are standards. Of course it can still be standardized. Like suppose if you take in UK, if a fertility center has more than 5% or 3% twin rate, their license can get cancelled in UK. అలాంటివి ఇంకా ఇక్కడ లేవు. నంబర్ ఆఫ్ ఎంబ్రియోస్ 2, 3, 4, 5, ఇప్పుడు వీళ్ళు 2 అని మాక్సిమం ఎప్పుడన్నా 3 అని ఇట్లాంటివి ఉన్నాయి. Definitely much more standardized than before 2021, and they gave us around 9 to 10 months to implement all those things, but there's always scope for improvement. Collecting the data, like in UK, every fertility center will report to the same body online. So we know the fertility success rates age wise. And I don't know why people don't try to think వాళ్ళు చూస్తారు మనం వేరే నెంబర్ రాయాలనుకోరు. ఏముందో అదే రాస్తారు, ఏముందో అదే చేస్తారు. ఇప్పుడు ఇక్కడ ఫర్టిలిటీ సెంటర్స్ అందరం అట్లాగే నిజాయితీగా నంబర్స్ అన్ని సబ్మిట్ చేస్తే నేషన్ వైడ్ గా ఏ ఏజ్ గ్రూప్ లో ఎంత సక్సెస్ రేట్, ఏ రీజన్ లో ఎంత సక్సెస్ రేట్. సపోజ్ ఇఫ్ యూ టేక్ కోస్టల్ ఏరియా, సక్సెస్ రేట్ ఈస్ హై బికాస్ దే ఈట్ మోర్ ఫిష్ అండ్ ఒమేగా యాసిడ్స్ ఉంటాయి కదా, చిన్న చిన్నవే. సో పీపుల్ కెన్ ఐడెంటిఫై అండ్ దెన్ దే కెన్ చూస్ ద సెంటర్స్ ఆర్ దే కెన్ చూస్ ఆర్ రియలిస్టిక్ ఎక్స్పెక్టేషన్స్ అబౌట్ సక్సెస్ అబౌట్ their age. Scope for improvement, ART law is there, savior.
So transparency is
very, very important. Lifelong transparency important. IVF flow, because you're dealing with the gametes of the couples, transparency is very, very important.
So ma'am, infertility ki sambandhinchi, how much of the percentage do you think is organic and how much of that is stress related in the current scenario? Meeki దగ్గరకు వస్తున్న couples lo ma'am.
Stress is such a killer.
Stress, ma'am.
Stress is such a killer. There are a lot of things. Apart from those things, if you add stress to that, it's such a big spoiler. Because the chronic stress especially, it increases the cortisol, it changes the estrogen, it changes the progesterone, it changes testosterone.
Especially women's body is always revolving around hormones and stress.
Hormones only. ఎందుకు ఇప్పుడు embryo transfer చేద్దామంటే గర్భాశయం లోపల పోరే endometrium that should be quite well developed, vascularized. చేస్తుంటే మామూలుగా అడుగుతానేమో స్ట్రెస్ ఉందా ఎందుకు అని అంటే ఇది సక్సెస్ కాదేమో అని స్ట్రెస్ పడుతున్నాను అంటది. ఆ స్ట్రెస్ సక్సెస్ కాకుండా ఉంటది, వదిలేసేయండి. ద మొమెంట్ యూ సే అయితే అయింది లేకపోతే లేదు, ఐమ్ డూయింగ్ మై బెస్ట్, ఎవ్రీథింగ్ విల్ ఫాల్ ఇన్ ప్లేస్. యువర్ జాబ్ ఇస్ టు డూ యువర్ బెస్ట్, లీవ్ ద రెస్ట్. It works so well for them to just get that concept right. Obviously everybody won't accept it then and there, but some people who understand that the results are magical, let it be in IVF or in embryo transfer. Stress has a big impact.
So ma'am, this brings me to other question. Ippudu treatment iche process lo ma'am, counseling, mental fitness gurinchi counseling, is that a part of the treatment ma'am? Are you doing that as a part of therapy or treatment which you are doing, giving it to your patients, or is there still a need to incorporate that in the regular treatment?
Like as I said, according to ART law, everything is standardized. Counseling is also a part of standardization. Every couple should be counseled and every couple should be explained and make sure they understand and they're not under stress. The one big difference about counseling in India, it's about telling, but counseling should be about asking. How do you feel? How much do you understand? Manaku vachini cheppatam kaadu, vaalla feelings adagadamu. So there will be a little different way of how we counsel, but it's all about open questions in counseling and how much do they understand, what will be the impact, what are they going to do if it fails, being mentally preparing
counseling ante enta sepu finances gurinchi percentage failure success rate anta ante anukuntaru ma'am, but apart from that, what is your regular job you're doing? How much of that is affected by this pregnancy? Do you, okay, important, andarki kavalanunna valle vastaru, but even if it is not there, what is your other option? Enti and explain cheyadam, that also should be a part of counseling. Most of them will not pay attention to it. Counsel chese vallaki interest unna, vine vallaki anta interest undadu, but that is what they require. I mean, patients require that.
We do spend a lot of time in all these things. Like yesterday, one of the males, he had different reports starting from zero count, eventually with different treatments and hormones, it came to 5 million. This was the 4th visit he was coming to. మేము మాట్లాడతాం రాస్తాం అంతా చెప్తాం. దెన్ హీ కమ్స్ అండ్ సేస్ నాకు అసలు ఏం అర్థం కావట్లేదు మేడం, అసలు నాకు పిల్లలు అవుతారా లేదో చెప్పండి. దెన్ ఐ జస్ట్ టర్న్ ద ఫైల్ టు హిమ్ అండ్ దెన్ షోడ్ ద రిపోర్ట్స్. ఇది అర్థమైందా, నేను ఇప్పుడు నీకు అంకెల్ చెప్తాను, నువ్వు నాకు రిపీట్ చేయి. 90 లక్షలు ఉన్నాయి స్పర్మ్ నీ దగ్గర, ఎన్ని ఉన్నాయి? 90 లక్షలు. ఎన్ని ఉండాలి? 1,60,00,000. ఐ జస్ట్ మేడ్ హిమ్ రిపీట్ ఆల్ ద నంబర్స్ అండ్ హీ వాజ్ సో హ్యాపీ దట్ హీ అండర్స్టూడ్. వీళ్ళు ఏంటంటే పాపం ప్రాబ్లం ఉన్నప్పుడు వింటారు, ఎగలదు ఇక్కడికి, ఇటు నుంచి వెళ్ళిపోద్ది.
ఇంకోసారి అడగడానికి కూడా మొహమాట పడతారు. నాకు అర్థం కాలేదని ఏమనుకుంటారు, వద్దనుకుంటారేమో, ఒకసారి అర్థం కాకపోతే టైప్ ఆఫ్ ఇంట్రోవర్ట్ పీపుల్ వాళ్ళు మళ్ళీ అడగలేరు.
సో ఫర్ మీ most of the times if they ask again, I understand they have crossed the barrier of shame of asking again. అయ్యో నేను అడిగితే ఏమనుకుంటారు అనుకోకుండా అడుగుతున్నారు, ఓపిక మళ్ళీ అట్లా చెప్తారు. There will be few people who ask to test again if you'll tell the same thing and all. I don't need to bother about this. I genuinely bother about people who are really in need and are desperate to have the treatment.
I think that is also one more important thing what young doctors should learn, ma'am. Ante time ichi patients ki explain cheyadam is mandatory because that is what they want. Percentage of failure అవి వాళ్ళకి తెలుసు అన్నిట్లో మ్యామ్. వాళ్ళకి కావాల్సింది ఎమోషనల్ కొంచెం ఆ సపోర్ట్, వినేవాళ్ళు. ఎగ్జాక్ట్లీ మ్యామ్, నా ప్రాబ్లమ్ ని విన్నారు, నాకు ఇది చెప్పారు, ఓకే అట్లీస్ట్ ఆన్సర్ తో వెళ్తారు. Because చుట్టుపక్కల వాళ్ళు అడుగుతారు కదా మ్యామ్. This is the next question. Social pressure on the couples who are trying to conceive. Do you think that is overburdening them than their natural problem, organic problem? వాళ్ళకి అసలు ఏముంది అనే దాని గురించి కంటే వాళ్ళు ఏమనుకుంటారు, వాళ్ళు అడుగుతారు, ఇంకా అవ్వలేదా అని అడుగుతారు, ట్రీట్మెంట్ తీసుకుంటారా అని అడుగుతారు, ఇంట్రెస్ట్ లేదా మీకు పిల్లల మీద అని అడుగుతారు. ఐ మీన్ దీన్ని వాళ్ళు ఎలా తీసుకోవాలి అనుకుంటున్నారు మ్యామ్? వాట్ ఈస్ యువర్ మెసేజ్ టు ద కపుల్స్ హు ఆర్ ట్రైయింగ్ టు కన్సీవ్? హౌ మచ్ షుడ్ దే లుక్ డౌన్ అపాన్ ద సోషల్ ప్రెషర్ and focus only on the problem and fixing it?
This is one of my favorite topic when I talk to the patients. Pressure ఇవ్వరు, తీసుకునే వాళ్ళే తీసుకుంటారు. 100 మంది 100 అంటారు. మనకి నచ్చినవి, మనకి ఎఫెక్ట్ అయ్యేవి మాత్రమే పట్టించుకుంటాం, మిగిలిన వదిలేస్తాం. సంబడి ఈస్ దేర్, ఫంక్షన్స్కి వెళ్ళటం ఆపేస్తున్నాము బికాస్ పీపుల్ విల్ ఆస్క్ మీ అంటే, ఐ టెల్ దెమ్, ఆస్క్ యువర్ సెల్ఫ్ వాట్స్ యువర్ ప్రాబ్లమ్. యూ వాంట్ టు హ్యావ్ చిల్డ్రన్ ఆర్ యూ వాంట్ టు హ్యావ్ చిల్డ్రన్ ఫర్ దెమ్? ఆ క్లారిటీ ఉంటే మీరు జవాబులు చెప్తారు. టెల్ దెమ్ ఐఎమ్ నాట్ ప్లానింగ్ చిల్డ్రన్ అని చెప్పండి. ఎవరు అడగరు కదా. మీరు ఈ మాట నన్ను అడగడం ఇష్టం లేదని చెప్పండి. ఏమనుకుంటారు, వీళ్ళకి పొగరు, మాట్లాడలేదు అంటారు. ఇస్ దట్ బెటర్ ఆర్ యూ గెటింగ్ హర్ట్ బెటర్? యూ హ్యావ్ టు చూస్ వాట్ యూ వాంట్ టు డూ. ప్రెషర్ ఎవరు ఇవ్వరు, మనమే తీసుకుంటాం. ఎక్కడ ఆపాలి అక్కడ ఆపేసి మనకు కావాల్సిన గోల్స్ ఆలోచించాలి. దిస్ ఇస్ సో ట్రూ.
That is true, ma'am. That is what they require right now. Many of them. In many various dimensions of their life.
It's up to how much we take. You ignore, it's gone.
True, ma'am. That's true. Ma'am, AMH levels గురించి ఈ మధ్య బాగా ఎక్కువ వెతికేసి చేంజ్ చేసుకుంటున్నారు, అప్రెన్సివ్ అయిపోతున్నారు, నాకు ఓవేరియన్ రిజర్వ్ తగ్గిపోతుంది అని. సో హౌ మచ్ ఆఫ్ ద వరీ అబౌట్ AMH is required and how much is not required?
I'm really glad people have knowledge that there's something called AMH and that should be taken care of. Like you take about my generation, we didn't need to think about AMH because we were married young, we had kids young, we didn't need to know our ovarian reserve. But because people are delaying marriages and childbirth, definitely they should know about their AMH. They don't need to worry, but even if they do one baseline, it will be fine thinking, okay, my AMH is matching my age group. Because honestly, you won't believe, I see so many of young girls in mid-20s, early 20s with an AMH of 0.2, 0.3, which is the AMH in women in 40s. There are a lot of things which are changing, but just imagine, they're planning to have children later. If they know, they can take precautions. Otherwise, they've lost the chance of getting children from their own having a child, their own biological child. They lost the chance of having their own biological child. So doing is good. Don't need to panic. Like these kind of tests, either they can go for a consultation or check it, but because they'll know there is a lab range, or if somebody is volunteering to get an AMH done, they know which age group what it should be. But I would definitely recommend, even if you're doing by yourself, always seek a consultation to ask if it's appropriate and what measures should be taken for that age group.
సో AMH అంటే అర్థం కాని వాళ్ళ కోసం అండి, యాంటీ ములేరియన్ హార్మోన్ బ్లడ్ టెస్ట్. అది మన దగ్గర ఆ హార్మోన్ లెవెల్ ఎంత ఉంది అని చూసుకోవడానికి, వయసుకు తగ్గ అప్రోప్రియేట్ గా ఉందా లేదా అని చెక్ చేసుకోవడానికి. సో అది డిటర్మైన్ చేస్తుంది మనము ఎంత ఛాన్సెస్ ఉంటాయి, ఇంకా తల్లి అవ్వగలిగే ఛాన్సెస్ ఇంకా ఉన్నాయా లేదా అని చెక్ చేసుకోవడానికి సింపుల్ బ్లడ్ టెస్ట్ అన్నమాట.
So that tells us about the ovarian reserve. Anal లో eggs కాకుండా అసలు బేసిక్ గా ఇంకా ఆ ఫీమేల్ దగ్గర ఎంత ovarian reserve ఉందని తెలుస్తుంది. It's a wonderful test.
True. మ్యామ్, ఇప్పుడు ఎగ్ బ్యాంక్స్ అనేవి వస్తున్నాయి కదా మ్యామ్, చాలా పాపులర్ అయిపోయింది. హౌ మచ్ ఆఫ్ ఇట్ ఇస్ to be taken seriously, and do you educate women to go for that or not? I mean, what is your take on it?
I am a very, very pro about egg freezing because I see so many women coming in their late 30s, early 40s asking for children. If only they took one step of freezing their own eggs in their the fertility. The maximum peak is in 20 to 25, and after that 25 to 30 is a small drop, 30 to 35 is a big drop, after 35 it's a steep decline. So best is to freeze before 30. ఇప్పుడు మొన్న ఒక డాక్టర్ వచ్చింది. She is a postgraduate and father is a multi-business and mother runs 3 hospitals. Egg freezing గురించి అడగడానికి వచ్చింది. And she says, అమ్మ చెప్తే ఎంత ఆశ్చర్యపోతుంది, అసలు ఏం మాట్లాడుతున్నావు అంటుంది. It doesn't matter what is the education, what is the financial background, this is not accepted yet. Like how 20 years ago IVF was not accepted, egg freezing is not a common thing yet. But I'm glad girls are thinking about it and coming forward, because she was 32. If she freezes her, no partner yet, don't know when she will have children. So if she freezes her eggs now, it will be, the time stops when she freezes her eggs. The eggs will be aged 32, even if she gets pregnant at 38.
True.
Otherwise 38 తర్వాత egg reserve తగ్గిపోతుంది, anomalous babies పెరిగిపోతాయి. I am very, very pro telling about freeze your eggs. If you know when you're going to get married, if you are married, if you know when to have children, don't bother.
Okay.
But you want pregnancies and marriage and childbirth after 30, freeze your eggs.
Definitely. Yeah.
You may not use it, but there's a safety and there in the background.
దాని వల్ల ఏమి డ్యామేజ్ అవ్వదా మ్యామ్? బికాస్ దెర్ ఆర్ అప్రహెన్షన్స్ అరౌండ్ ఇట్. ఓవరీలోకి ఒకసారి మళ్ళీ నీడిల్ వెళ్ళిందంటే ఎందుకు అనవసరంగా డిస్టర్బ్ చేస్తున్నావు అక్కడ ఎన్విరాన్మెంట్లీ టైప్ లో మాట్లాడతారు. సో దట్ ఈస్ రాంగ్. దట్ ఈస్ వాట్ యువర్ సేయింగ్.
దట్ ఈస్ వన్ మిత్. అండ్ ద సెకండ్ మిత్ ఇస్ ఆ ఓవరీ బ్యాంక్ ని కొల్లగొట్టేస్తాం అనుకుంటారు. అదొక వాల్ట్, స్టోరేజ్ వాల్ట్, అందులో కొల్లగొట్టము. ఎవ్రీ మంత్ సర్టన్ నెంబర్ ఆఫ్ ఫాలికల్స్ ఆర్ రిక్రూటెడ్. ఆ స్టోరేజ్ లోనే అలాగే ఉంటాయి. ఆ మంత్ లో రిక్రూట్ అయిన వాటిని మాత్రమే తీసుకుంటాము. మనం the professor I trained under, వాళ్ళ ఫ్యామిలీ మెంబర్స్ కి IVF చేస్తున్నా. అయ్యుంటో వాళ్ళ ఎగ్స్ అన్ని మొత్తం తీసేసుకోగదు నువ్వు. లేదు మేడం, ఈ మంత్ లో రిక్రూట్ అయిన మాత్రమే తీసుకుంటాను.
Ma'am, as a pathologist, I have this doubt also. How much ever good quality embryo is formed, sometimes endometrial receptivity is not there. That is also leading to IVF failures.
True.
So, what do you suggest for such kind of scenarios, ma'am?
Yeah. So for somebody to get pregnant and have a successful ongoing pregnancy, ఇప్పుడు మట్టి ఎంత ఇంపార్టెంట్, విత్తనం ఎంత ఇంపార్టెంటో ఎంబ్రియో అండ్ ఎండోమెట్రియం కూడా ఈక్వల్లీ ఇంపార్టెంట్. ఒకటి బాగుండి ఇంకోటి బాగాలేకపోతే ఏమవుతుంది? సపోజ్ ఎండోమెట్రియం is not good and embryo is good, irrespective of it, pregnancy won't happen. Or it will happen but it won't continue and there will be a lot of miscarriages. Without even realizing why the pregnancy is coming and not coming. So both are equally important. Both should be checked. Embryo in terms of quality, and if people are above 35, the genetic evaluation of the embryo as well. And the endometrium, the thickness, the blood flow, there's no infection, and the thickness is enough to take the implantation. And there is receptivity as well, as you said. Some people will have like most people will have 3 to 7 days of implantation. ఆ టైంలో ఎప్పుడు ఎంబ్రియో కనెక్ట్ అయినా వచ్చేస్తుంది ప్రెగ్నెన్సీ. బట్ సమ్ పీపుల్ విల్ హ్యావ్ నారో విండో. ఐడెంటిఫైయింగ్ దీస్ పీపుల్, ఐడెంటిఫైయింగ్ ద విండో, దట్స్ ఈక్వల్లీ ఇంపార్టెంట్ ఇఫ్ గుడ్ ఎంబ్రియోస్ ఆర్ ఆల్సో నాట్ గివింగ్ ప్రెగ్నెన్సీ.
మ్యామ్, మీ ఓపీడీకి వచ్చే వాళ్ళల్లో మీరు ఇద్దరిని కపుల్ని కూర్చోబెట్టుకుని యూ విల్ కౌన్సిల్. సమ్ టైమ్స్ కపుల్ ఆర్ నాట్ కమింగ్, ఓన్లీ ఉమెన్ కమ్స్, ఉమెన్స్ in-laws comes, and husband is not there itself in this entire journey, whole game. What do you tell to that couple? Meek ent important woman role undo, ante important male role kuda undi, and how do you explain them? I mean, you'll tell it on their face and they'll not see you again if you are really very stubborn with such kind of scenarios. But వాళ్ళకి education, lack of education, they say only a woman de undi idantha mottam anukuntunnaru. వాళ్ళు ఇంకా ఉన్నారు కాబట్టి I just wanted to ask, and I just wanted everybody else also to know that what are you going to tell them? They're important.
So I'll talk about 2 things about male not participating and how the times are changing. It's quite refreshing nowadays, especially last 3 months lo, at least every 2 weeks I'm getting one male coming alone. ఇద్దరము ట్రీట్మెంట్ తీసుకుంటున్నాము, నాకేమన్నా ప్రాబ్లం ఉందా, తన మాటికి వెళ్తుంది, నాకేమన్నా ప్రాబ్లం ఉందా చెప్పండి. ఐ వాంట్ హర్ నాట్ టు బీ టేకింగ్ అన్నెసరీ ఎక్స్ట్రా ట్రీట్మెంట్ జస్ట్ బికాస్ ఐ హ్యావ్ అ ప్రాబ్లమ్ అండ్ మై ప్రాబ్లమ్ ఈస్ నాట్ సార్టెడ్. It's quite refreshing and rewarding to see men coming forward to ask their issue. That's one kind of male when he comes alone without wife. The second kind of male who comes without wife, they already know the sperm count is 0. ఇక్కడ వైఫ్ ఉండదు సీన్లో, వాళ్ళ ఫాదర్తో మదర్తో వస్తారు. సో when the female has a problem, obviously men's parents won't be as protective of her, but వాళ్ళ అబ్బాయికి అయితే మాత్రం 0 sperm count వాళ్ళు, I keep getting people from Andhra and different places నుంచి, I do lot of male infertility, వస్తారు. Yeah. And fortunately I'm like a tertiary referral center, అక్కడిక్కడ ఫెయిల్ అయిన కేసెస్ చాలా వస్తాయి నా దగ్గరికి. ఆ స్టేజ్ లో వస్తారు కాబట్టి నాకు మేల్ రాని సిచ్యువేషన్స్ చాలా తక్కువ. ద ఓన్లీ టైమ్ ఐ డోంట్ గెట్ మేల్స్ ఇస్ EMI వచ్చేస్తుంది మోస్ట్ ఆఫన్ టు వన్ ఆఫ్ ద సెక్ట్ ఆఫ్ గ్రూప్. మా ఆయన రానంటున్నాడు, మీకు ఆల్రెడీ పిల్లలు పుట్టారు కదా, నువ్వు చూపించుకో, నేను రాను అంటున్నాడు. ద ఓన్లీ థింగ్ ఐ ఆస్క్ దెమ్ ఇస్, I'll treat you, I'll check you have good uterus, you have good ovaries, you're ovulating, your tubes are fine. చెప్పినప్పుడు ఇంటికోసుకు ఒప్పుకుంటాడు ఇంట్లో, లేకపోతే పిల్లలు పుట్టారు కదా. Yeah, దట్ ఈస్ ఫైన్. సో ఐ జస్ట్ హెల్ప్ హర్ టు మేక్ షూర్ షీఈస్ రిలీజింగ్ ద ఎగ్ అండ్ ద హార్మోనల్ సపోర్ట్ ఈస్ గివెన్ అండ్ టెల్ హర్ టు హ్యావ్ ఇంటర్కోర్స్ ఎట్ హోమ్. అది ఒప్పుకుంటారు. అండ్ దర్ వాజ్ వన్ కపుల్, చక్కగా ఉన్నాడు, వెరీ వెల్ ఎడ్యుకేటెడ్, 6 feet tall, జిమ్ ట్రైనర్. వైఫ్ కి చిన్న ప్రాబ్లం ఉండింది, లాప్రోస్కోపీ చేశాను. बाबू नी सेमिनाल्स ఏంటి, ఆమెకు ఆపరేషన్ చేస్తున్నాం అంటే करता हूं 3 महीने टाइम तो 3 महीने में प्रेगनेंसी नहीं आया तो फिर करता हूं मैं. आ 3 months లో ప్రెగ్నెన్సీ వచ్చేసింది. సో ఐ డిడ్ంట్ నీడ్ టు.
ఓకే, ఐ మీన్ when we tell them that there is some issue with your semen analysis, how receptive they are for that, ma'am?
You know what, every single consultation, so I sit like this, across me there will be two chairs. ఇద్దరు రిజల్ట్స్ చక్కగా పేపర్ వాళ్ళ ముందు తిప్పి, ఇది ప్రొలాక్టిన్, ఇది TSH ఎక్స్ప్లెయిన్ చేస్తుంటా, ఇద్దరు వింటుంటారు. నెక్స్ట్ లాస్ట్ పెడతా సీమెన్ అనాలిసిస్. ఈ సీమెన్ అనాలిసిస్ ఇట్లా ఓపెన్ చేస్తాను, ఇట్లా చేస్తారు. ఎవ్రీ సింగిల్ మ్యాన్,
దట్ ఇస్ focus of interest for them, curiosity,
and and it still amazes me how anxious they are regarding the result. అది ఒక్కొక్కటి చెప్పేసి కౌంట్, మోటిలిటీ, పర్ఫార్మెన్స్, క్వాలిటీ, డిఎన్ ఇదంతా చెప్పిన తర్వాత ఇంకా రిలాక్స్ అవుతుంది. Maybe I don't know if I'm seeing it right or not, but I feel women's perception and acceptance of not so good news is better than men's. My anesthesist always says, like we do so many egg collections and laparoscopy and all, and we also do the testicular sperm aspiration. He always says, men chala pirikold, he's a man obviously, men chala pirikold madam, women are so much stronger.
Yeah ma'am, really. అంటే వాళ్ళకి ఏదైనా ప్రాబ్లం ఉన్నా యాక్సెప్ట్ చేసి వెంటనే ట్రీట్మెంట్కి వెళ్ళడానికి కూడా రెడీగా ఉమెన్ ఉంటారు. విత్ ఆల్ దట్ ఇంజెక్షన్స్, ఇట్ ఇస్ అ పెయిన్ఫుల్ ప్రొసీజర్ ఆల్సో నో IVF. సో అదంతా దానికి రెడీగా ఉంటారు. వాళ్ళ బాడీలో హార్మోన్స్ కూడా డాన్స్ చేస్తూ ఉంటాయి, మూడ్ స్వింగ్స్ అవన్నీ. విత్ దట్ దే డీల్ ఆల్ దోస్ థింగ్స్. కానీ జస్ట్ ఒక ఇది ఉంది, ఈ ప్రాబ్లం ఉంది, దీన్ని కొంచెం ఇది వాడు అని చెప్తే కూడా వాళ్ళు అలా షై ఆఫ్ అయిపోయి, I mean this is not really, maybe they need to be educated or upbringing nunchi kuda cheppadamu.
It's changing a lot. But there's still room for progress. You said IVF painful. I want to touch that point.
Even I wanted to ask. Ippudu painless IVF kuda vastundi.
So IVF is painful etla? Scans, injections, egg collection, embryo transfer, 4 steps ఉంటాయి. Scans are painless. Injections, I'm glad that you know that there are needle-free injections now. So scans are painless, needle-free injections are painless, or even if the needle was there, it was 26 kg needle. I completely agree, there's mild pain during that. Egg collection is the 3rd step, which is done under anesthesia, so not painful. Embryo transfer, it's like any scan, a little additional procedure, but it's not painful. So in the 4 steps, there's minimal discomfort, no pain. You know where the pain is? Emotional.
True, ma'am.
Totally emotional. And financial, if they have difficulty in money. Physical pain is very less. Financial pain in people who need. Emotional pain and the fear of unknown, fear of don't know if it's successful or not. There's so many injections, so many hospital visits involved. A person is completely different on the day we give them positive news. But the కష్టమంతా మర్చిపోతారు. Our stories are all outcome based. If the outcome is good, whatever hardship they've gone through, how much ever money they have spent, they are strong enough. Otherwise, even for the small problem, because of the expectations built up and the effort they put in, taking the no and there's no pregnancies, I can understand it's totally difficult.
True. So ma'am, for the couple who have been trying to conceive for 1 year without any protection, and then they see that they are not conceiving, they will see a fertility specialist. And then అప్పటి నుంచి వాళ్ళ ఎంటైర్ లైఫ్ స్టైల్ మారిపోతుంది ఇన్ వన్ వే, బికాస్ దే విల్ హ్యావ్ వరీస్. ఇది అని మేము లేబుల్ చేస్తే ఫస్ట్ ఆఫ్ ఆల్ స్టెప్ బై స్టెప్ వాళ్ళు దే విల్ అండర్గో సమ్ ఇన్వెస్టిగేషన్స్. తర్వాత దట్ హోల్ జర్నీ it will involve a lot of fear, apprehension, faith, courage, finances, and also ఇంకేమన్నా ఇలా సోషల్ ఫియర్, సోషల్ కలర్డ్ అని కూడా అలా అంత జర్నీ ఉంటుంది కదా. సో త్రూ అవుట్ ద జర్నీ వాళ్ళు ఒక్క డాక్టర్కి స్టిక్ అయి ఉండకుండా మధ్యలోనే జంప్ అయిపోతూ ఉంటారు. సో ఐ మీన్ దిస్ ఇస్ వెన్ దే ఆర్ డూయింగ్ ఆల్ ద థింగ్స్ విచ్ ఆర్ ప్రిస్క్రైబ్డ్, మధ్యలోనే జంప్ అయిపోతూ ఉంటే యూ విల్ బి ఎక్స్ప్లెయినింగ్ దెమ్ అబౌట్ ద పర్సెంటేజ్ ఆఫ్ ఫెయిల్యూర్ అండ్ సక్సెస్ ఆల్సో. సో వాట్ యూ టెల్ టు సచ్ కపుల్స్ మ్యామ్? అంటే మీరు క్లియర్ గా చెప్పినా కానీ వాళ్ళు దేర్ కాంప్లైన్స్ ఇస్ నాట్ దేర్. సో అలాంటి వాళ్ళకి బికాస్ దిస్ టేక్స్ పేషెన్స్ ఆబ్వియస్లీ. సో ఒకసారి ఫెయిల్ అవుతే రెండోసారి, మూడోసారి అలా ఇఫ్ యూ కెన్ కోట్ సమ్ ఎగ్జాంపుల్స్ వేర్ ఇన్ ఒక ఎన్ నెంబర్ ఆఫ్ టైమ్స్ తర్వాత సక్సెస్ వచ్చిన వాళ్ళు who were sticking on to you only, hanging on around you only, and then they finally saw success. For such people, if you want to say some examples.
Yeah. So I'll cover this in two aspects. So when people come with different hospital files and all, ముందు చూసుకుంటాను ఎంతెంత కాలం వెళ్ళారు. There are people who give a doctor only one chance of consultation. Some people go for 3-4 consultations.
వాళ్ళే ఛాన్స్ ఇస్తున్నారు.
ఇలా జరగగానే ముందు ఇన్ఫర్మేషన్ అంతా చూసిన తర్వాత ఫస్ట్ క్వశ్చన్ యాజ్ దెమ్ ఇస్ నాకు ఎంత టైం ఇస్తున్నారు.
With all the experience now, you know.
They don't expect that question from me. So I'll add one more file to your bag, but how much time are you giving me? And then I ask them, do you understand? You're changing the doctor. You two are same. You're not, the problem you have, you're taking the same problem to different places. If the problem is same, how do you expect the outcome to be different?
True.
I think I always feel a kind of moment in their understanding. Avunu kada anna ardhamainattu anpistadi. And then this is one aspect of it. The second thing of people sticking, this is quite common practice for me. People come with 2 failed IVFs, 3 failed IVFs and all. And they go, I also see notes where they get another IVF done months after the 3 failed IVFs. So I always tell them, fail అయింది, ఫెయిల్ ఎందుకు అయిందో కనుక్కుందాం ఫస్ట్, దెన్ యూ థింక్ అబౌట్ IVF. వన్స్ వీ ఫైండ్ అవుట్ దెన్ ఐల్ టెల్ యూ వాట్ ఆర్ ద వేస్ ఆఫ్ గెటింగ్ ప్రెగ్నెంట్ అండ్ ద సక్సెస్ రేట్ విత్ ఈచ్ మెథడ్, బట్ డోంట్ ట్రై టు గో ఫర్ IVF. మీరు IVF చేయించమంటే నాకు డబ్బులు వస్తాయి, బట్ యు ఆర్ నాట్ హియర్ టు గివ్ మీ మనీ, యు ఆర్ హియర్ టు టేక్ అ బేబీ. సో లెట్స్ వర్క్ టువర్డ్స్ దట్. అంటే సమ్ పీపుల్ ఆర్ సో గ్లాడ్ టు హియర్ దట్. Actually IVF expensive అనుకుంటారు. Investigations to find out why it failed are more expensive. But because they've spent so much of efforts, time, money, emotions and hopes, they really want to know why it didn't happen. So, and knowing it makes it so much easier, and they have to give chance. Sometimes everything is good, still something is missing. And there's another example I always think about. Just imagine getting into a flight and they tell you the 70% chance of landing, 50% chance of landing. But the fertility, there's nothing more than 50% at the moment we can give. Most beautiful endometrium, most genetically normal embryo petna kuda, probably the maximum I see is 70. So this is what is science up to now, and as it progresses, probably when they started it was like 3 to 5%. Now we reached 50. So we'll just watch the progress happen.
Ma'am, personalized fertility medicine ki scope enti ma'am? Are you already starting it? I mean, meer already aladi start chesi మీ facilities lo you're doing it. What is your take on it?
I only do personalized medicine. Because they are not objects. They are not 2 washing machines. They are not 2 grinders. They are them. Everybody's weight is different. AMH is different. Sperm motility is different. Index is different. Smoking is different. Background is different. What they eat is different. You cannot think one size fits all. They have to be totally personalized. If we cater all these things, a quarter of it will be making their lifestyle and their nutrition better. Or simple things like correcting thyroid hormone and all. That's the basic step. Unless you see that, if you think box standard IVF andarki cheddam anukunte vallu IVF kosam raaledu, vallu pillal kosam vacharu. If you understand what they want and you try to deliver what they need and what they desire, half the game is done. Totally personalized. Some people have IVFs and they don't get eggs. Sometimes it's because of some hormone receptor deficiency. If you find out, next time you'll get embryos. Rather than saying నీకు eggs రావు ఇంకా, నీ దగ్గర eggs లేవు, you can't mother a baby with your eggs. No, just find out. You will find an answer. That's why I love looking into the old notes. కట్టలు తీసుకొచ్చినా సరే, either I find what worked and to continue, or not to do something which didn't work. Both ways I'll be benefited. And it saves her journey and her cost. Always personalized.
This is something like flowcharts follow each chesedi kaadu, ma'am.
Kaadu.
Not like that. It's like a detective job.
That's
you
it.
need to look into it.
I love the word. Honestly, Sherlock Holmes lage
Sherlock Holmes
emundi.
Yeah.
And as I flip the files, I keep writing it. Whatever I identify, I write the facts.
You pin it and then it work out to me. Then what next?
Yeah.
So it's like personalized.
Totally
definitely.
personalized. Totally
so
personalized.
Every case is like different.
Yeah.
And you need to, and because you have that curiosity to dig into the details,
very,
you are even more enjoying this.
Very curious. Yeah.
True, ma'am.
Yeah. That's why even if it is fertility consultation, for me every consultation is different. Veelike problems unna, veelike problems, veelike solution kavali.
Yeah. Ma'am, is AI genuinely helping in embryo selection? What do you think?
I am again I'm a very pro AI person. The only thing what we have to do as this generation, give the right information. At the moment in Genesis, we are trying 4 AI softwares which will help in embryo selection.
Okay.
We are being a little smart. We already have the embryo pictures. So we are doing using the software. Some embryos we are loading which are still with us, we didn't transfer. And some embryos we are loading which have given pregnancy or given miscarriage.
Okay.
So that will give me a very good idea about which software is going to give me a good news. Yeah. So soon we'll have one of the, out of the one I'm trying, the best one will soon implement.
Yeah, true,
but the benefit of AI is standardization. Like we load the embryo, there's a grading of 4, 5, A's and B's. So me and the embryologist will sit there, I'll say 4A, he'll say 4A, machine says 4A, and then we high-fi saying, oh, we are all matching. We didn't see much discrepancy because I'm very, very particular about right way of classification according to the European standards. Standardization. Yeah, junior embryologists, small centers, big centers, if they have AI, and they're not expensive as well. At least you know what grade it is, and you can counsel the patient better.
True. Yeah. So for the people who don't know, Madam studies paina, research paina, she's very much pro into it. So almost 150 publications in national and international journals lo she published all those papers and also presentations icharu. She won many awards and she got felicitated for all her work into the research and all. So that is what makes her stand out of the crowd, because she'll look at each case differently and she'll try to dig in why it is not working. And ma'am, this brings me to other question. For the couple who you finally come to a point that they are not going to conceive, when you reveal that thing to them, how are they receptive about it, and what if they are going to change you and go to another fertility specialist and try, but you are not going back and you're just telling them that this is not going to work out with you? వాళ్ళు ఎంత receptive గా ఉంటున్నారు, and how do you counsel them, ma'am?
Fortunately, a very, very small fraction of people where I need to say, మీరు ఎప్పటికీ జన్మలో పిల్లలు పుట్టరు అని, because there's always options.
Okay.
The toughest the only time when I have to say that news is somebody doesn't have a uterus, somebody don't have eggs, or somebody don't have sperm. For all the 3, there are alternative options: donor eggs or donor sperms or a surrogate. Adoption. So I always tell them what it is, and I always tell them what are the alternative options, and I always ask them to go and sit and think about it. The first person who breaks the news is the bad person. If they already know they have azoospermia and the testis never develops sperm and it's a failure right from the development onwards, they don't. It's not the disbelief on the doctor, it's the disbelief on what is happening to them. Second time when somebody says, they accept it. I have patients where they don't have testis, very small testis. They come back 6 months later. Been there, gone there, injections, surgery annaru. Devude ivvaledu. Nobody can do anything. They'll take time, but they'll come there. Some people really struggle to accept donor elements. For me, I do the donor eggs or sperm counseling as if I'm going to break them a bad news. It's not easy to accept. I can understand that. But the desperation of having a child is so high, they don't mind accepting donor. And the happy thing from my side, I see the couple coming with their kids, I see them for our anniversaries and all. They are in their happiest time of their life. They forget the source of egg or source of sperm. They forget the source of egg or source of sperm. They're very happy they have a child in their hand. I feel blessed to be able to make families so happy.
True, ma'am. Yeah, that's amazing. I know having a kid around will make them forget about everything. And how open are they for adoption, ma'am? The couples who are coming to you, when you suggest them about this, nothing is going to work for you. you can go with that.
My understanding is they are more acceptable of eggs and sperm than adoption. Adoption, everybody knows it's an adopted child. And when we use donor eggs or donor sperm, she's pregnant, she's carrying, people won't know that it is from the not a biological child.
I mean, when both of them have problems in such scenarios, ma'am.
If I need donor egg and donor sperm.
Okay, both wife and husband have problems.
Yeah, but she can still get pregnant if she has a good uterus.
Good uterus.
Yeah. So what people see is a bump and her delivering. True. They don't know the rest of the background.
Yeah, true.
And this, having said that, there is a sector of people, as well as the patients, if they go to IVF center, it might not be their egg and their sperm.
True. Yeah, ma'am.
I do use other people's eggs and other people's sperm. Only if they need and they consented. Only according to the ART law and taking all the signatures and affidavits. We don't use if they don't need and So people have to be very genuine and cautious about what they're asking for and what they're choosing.
Ma'am, how relevant is genetics becoming in fertility planning?
Genetics has always been relevant, but being used more often now. Like after 35, the chance of a woman having a Down's baby is like 35%. And there are a lot of pregnancies after 35. That is one common scenario. And the other common scenario, uncommon scenarios being family history of anomalous babies or previous child with anomaly. Those people will need. But it's quite helpful. Like there was one couple, we did IVF, we got 2 embryos. We did the genetic study. Both the embryos were abnormal. He was so unhappy. You told us that if you do the genetic testing, my success rate will go high. Then I said, we did say, but we also said, if it is normal. So people in stress, they conveniently forget what has been said. And then I always tell the bright side of it. If we didn't do the genetic testing, we would transfer those embryos. They would fall pregnant to miscarry. That's more heartbreaking than a failed cycle. This cycle is totally wasted, lot of money and time invested. There are no embryos to transfer, but at least they didn't have miscarriage or they didn't have a failed cycle where we transfer and they give a pregnancy negative news.
True. Yeah, that's true. Ma'am, are we over-testing the couples in modern fertility practice? What do you say about it?
Depends on where they're going. Yeah, depends on what they're choosing. So the minimum test, I'd definitely say for a woman, egg reserve, thyroid, prolactin and a scan. For a man, sperm, thyroid, prolactin. So these are minimum. Anything over those could be based depending on their circumstances, like strong family history of diabetes, or they're obese, or they're stressed and late nights and all, add test for diabetes. But we don't need more than these to identify the basic problems.
Right.
But if they've been trying for long, they had failed miscarriage, failed cycle, then that's a different scenario.
True. Ma'am, what is the toughest conversation you have with couples out of all this? I mean, they come with a baggage or a fresh couple. Compared to both of them, which is the toughest conversation phase you feel with the couple?
For me, the toughest is always you can't have a biological child. Like somebody comes with AMH of 0.02, she has no eggs, or 0 sperm and FSH is high, his body can never make sperm. I find those consultations toughest because, especially if that's their first fertility visit, because they'll be trying for 6 months, 1 year, 2 years, and they never expect that they have to listen to this news. I find it very hard to say you can't have your own biological child. Then the good side is you can still have a child, but this is what it is. And I always tell them, take your time. This is only information session. Come back to me and let me know what your thoughts are.
Have you ever cried with that couple when they break down, when they hear this news, along with them? That type of scenarios have you ever faced?
I didn't cry with them, as I said. I'm emotionally not attached.
True.
I think only one time I remember. It was very lovely, sweet couple, and they had 4 failed miscarriages, 4 failed IVFs, and they got pregnant. That lady was so sweetly crying, and like everybody in the room, we had
happy tears.
Happy tears.
Yeah.
And you know what? I see more tears when I break the pregnancy positive news than the negative news. Whenever we say the pregnancy is positive, they are very, very overwhelmed and the stress busted, they cry. When we break the negative news, they go quiet. Very few people cry.
They take some time to digest that.
Yeah. The crying in my room happens more with positive pregnancy test. Repeated IVF failures is not easy. Not easy on many, many counts. One, the hopes are shattered. Some people are broken. everybody is broken, at least initially. Then they probably start evaluating and thinking, what do I mean when I say broken? Physically, financially, emotionally. And then the fear, will I ever get pregnant? Physical, there are also a lot of concerns thinking, will this failure and the IVF treatment have impact on my life in the future? I want to clarify at this moment that every injection we give lasts only for 24 hours. There's only one depot injection will last for one week. Apart from that, there's no impact of the hormones on the body. What impacts is the emotional trauma they go through, of the journeys where they don't reach a destination. So that needs support from within, from the partner, from immediate family on the both sides, and friends. And who is least in this game? Husband. Everybody thinks about the wife, and husband has to take care of her as well. I always ask, how do you feel? How are you? It is hard. Like, so many people need support, rather than thinking. See, what happens is when somebody has a grief, everybody should try to think about them, but people start talking about themselves. నాకు అక్కడ వాళ్ళు తెలుసు, నాకు ఇక్కడ వీళ్ళు తెలుసు, ఇక్కడికి వెళ్తే బాగుంటుంది. So people don't have time to grieve. There's so much of other information not allowing them to grieve, and that's always it's buried and it comes out later. So people should be allowed time to grieve, and then people should ask, what do you want, rather than tell what they think is right. It is tough journey, but people should not lose hope.
True.
There are very, very rare cases where they can't get pregnant. If they have eggs, if they have sperm, if they have uterus, it's a matter of time of identifying what works. And if you execute everything, the success rates are more than 70% when you find out the cause and treat it. Again, it's not 100. So you may still, in spite of finding out, you might still need to do one more cycle, but it will happen. Just positive energy is very, very important.
When we have such expertise around it, it's always important to use it and utilize చేసుకోవాలి. మనం యూజ్ చేసుకోకుండా ఎంతసేపు మనకి ఇంకింతే అని ఆ డిప్రెషన్ లో మాత్రం ఉండిపోకూడదు. That's what I feel. When there is help around, you should grieve, come back, gather yourself again, and then seek for the help.
Take months, take two. You know what surprises me? Sometimes I have few embryos with a couple.
True.
సంవత్సరం తర్వాత వస్తారు, ఫెయిల్ అయిన తర్వాత సైకిల్. They sometimes take 1 year to. And పోనీ నేను సక్సెస్ రేట్ చెప్పలేదా అనుకుంటే, ఆబ్వియస్లీ ఈవెన్ ఇఫ్ ఐ డోంట్ రిమెంబర్ వాట్ ఐ సెడ్, బట్ ఇట్స్ రిటన్ ఇన్ ద నోట్స్. ఎందుకమ్మా 40% చెప్పాను కదా, ఎందుకంత లేదు మేడం వచ్చేస్తుంది అనుకున్నాను. సో ఇట్స్ ఓకే ఫర్ దెమ్ టు ఫీల్ ద వే దే ఫీల్, బట్ సపోర్ట్ షుడ్ బి దేర్ ఫర్ హెల్ప్ దెమ్ కమ్ బ్యాక్ out sooner.
This is a very interesting point, ma'am. I just wanted to highlight this one thing. Ante fertility treatment iche doctor ki bodies ni instruments laga chustaru ani misconception undandi. Kaadu. Ma'am lanti vallu, they are giving time to grieve. It is very important అని చెప్తున్నారు. నెక్స్ట్ ఇమీడియట్ సైకిల్ కి రష్ చేయట్లేదు. మీరు ఇలాంటి ఫాల్స్ ఇన్ఫర్మేషన్, ఫాల్స్ ప్రాపగండా నుంచి గ్యాదర్ చేసుకొని భయపడుతున్నారు in your own dens. But if you come out, break the walls and reach out for help, and you are open-minded, then you'll understand that basically everybody is trying to treat you as human as possible with all the latest level of all the expertise, advanced thing available. They're trying to cater it to you at some cost, whatever is mandatory at that cost. But they need your involvement also. That is the most primary important thing, Andy. That is what I wanted to tell, ma'am. I mean, this is so nice that you're giving time to grieve.
Very important.
You should come back to your normal level and then go for next cycle. That is really very important.
They feel so lighter once they understand and accept accept the loss, and then be ready to move on for the next time.
Only then they'll be ready, I think, ma'am. And they can't rush into things also.
When couples ask me, when can we go ahead? I tell them medically, I'll scan and I'll look and tell you. But emotionally, you should tell me when you're ready to face a negative result again, then you're ready. Positive result, everyone accept chestam. Are you ready to face another negative result? Then you're ready.
True, ma'am.
No point in pushing them, and then they'll go so down that it will be very difficult to bail them out.
True, ma'am. How do you deal with the couple's parents, ma'am? Both side parents will come with two different types of things sometimes. Couples are okay, but they will arise conflicts.
Yeah.
Then how do you deal with them? You'll be like,
ఓపెన్ క్వశ్చన్ ఏం కావాలి అని అడుగుతాను.
again,
ఏం
is it
కావాలి?
not like నా కపుల్ ఇద్దరు రండి,
Huh.
మీకు ఏం కావాలి మీరు మాత్రమే
No.
చెప్పండి.
I love having everybody in the room.
Oh, okay,
Yeah.
okay.
ఎందుకంటే పాపం వీళ్ళు see sometimes people might be hesitant to tell the facts or the success rate or the whole of it, and sometimes వీళ్ళకి నేను చెప్పిన దాంట్లో వీళ్ళకి 90% అర్థమై 90% లో వాళ్ళకి చెప్తే వాళ్ళకి 30% అర్థమై, so what is the end result is very less.
Correct. Yes.
Sometimes when the one of them says అక్కడ నుంచి చాలా ప్రెషర్ ఉందంటే నెక్స్ట్ కన్సల్టేషన్ తీసుకొచ్చేయండి అని చెప్తారు. Because what happens to these people, they'll get support from them, because they also understand they're all in the same journey rather than working against each other. And I always tell both man and woman, వాళ్ళు అంటున్నారంటే తప్పు కానుకోవద్దు. వాళ్ళకేం కావాలి, మనోడు మనోరాలు కావాలి, తప్పు కాదు. ఆతృతలు ఏదో ఒకటి అడిగారు అనుకోండి, అది ప్రెషర్ తీసుకోకండి. ఇట్స్ ఇన్ యువర్ హ్యాండ్స్ టు టేక్ ఇట్ as a pressure or think it's a desire. మీతో పాటు they also want you to have a child, and you are the same party అనుకోండి, you'll be relieved. Yeah.
That's a nice perspective, ma'am. Again.
Yeah.
Ma'am, a few rapid fire type of questions. One fertility myth you want to ban permanently.
Women is responsible for fertility.
Yeah, both are responsible.
Yeah, both. Yeah.
Tea or coffee during IVF, ma'am?
Tea is okay. Coffee has caffeine, which can have effect on the sperm and egg quality.
Okay.
Teas are okay. Decaffeinated coffee is okay.
One food couples overrate for fertility, ma'am?
Whatever they see on the reels, it తింటే అయిపోతుంది, ములకాడలు అంటారు, డేట్స్ అంటారు. Just it should be balance of lot of things rather than just one food item. Yeah.
Moderation is
Yeah.
Most googled fertility misconception, ma'am?
Food, I think. Fertility foods. Yeah.
One thing men should stop immediately.
Smoking. Smoking is a very big impact on the quality of the sperm. Stress for both. Yeah.
One thing women should stop stressing about, ma'am?
I want to get pregnant next month. Yeah, just leave it. Do your hard work, and then rest will follow. Yeah.
Natural conception or IVF, which is more misunderstood, ma'am?
IVF. Two ways. One, they think it is dangerous, harmful, lot of injections. That's wrong. Two, IVF. You go to IVF center, you should come back with a baby. That's also wrong. It doesn't happen. It's 40-50% is the highest success rate. Yeah.
Most emotionally rewarding moment in your career, ma'am? This is not a rapid fire thing, I think. It takes some time to answer. Okay, you can answer at your own time.
I think when I see the babies, because I see them as embryos. I see the embryos under the microscope. I see them 1 centimeter, 2 centimeter scan, and they walk alive into my clinic. It's so lovely.
Yeah. I think you ఒక లెవెల్ ఆఫ్ స్పిరిచువాలిటీకి వెళ్ళిపోతారు అనుకుంటా కదా మ్యామ్, సీయింగ్ దట్ ఫ్రమ్ దట్ దిస్ లిటిల్ సైజ్ టు హ్యూమన్ ఫార్మ్.
హ్యూమన్ ఫార్మ్.
One celebrity myth about fertility you dislike?
నేను ప్రెగ్నెంట్ అయిపోయాను అని వాళ్ళు పెడతారు, వీళ్ళు పెడతారు, అది ఏజ్ ఎక్కువ ఉంటుంది. ఇది చూసేసి వీళ్ళు లైక్ ఐవ్ సీన్ వన్ ఇన్స్టాగ్రామ్ రీల్ వేర్ somebody was talking saying they scare you when you're 40 that you should have IVF or you have abnormal babies. I got naturally pregnant, and so many views, likes, shares to the reel without understanding there are 1 lakh or 10 lakhs of 40-year-old women, and she is the one who got pregnant. People should have realistic expectations of the age, ovarian reserve, and the success rate. They can't think. That's where they really go depressed, because ఆమెకు వచ్చింది నాకు రాలేదు కాదు. What is your physical health and what is your husband's sperm health and what is your egg reserve? ఒక్క రీల్ చూసేసి ఎవరినో చూసేసి ఇన్ఫ్లుయెన్సర్స్ని ఫాలో అయిపోయి సెలబ్రిటీ ఫాలో కాకుండా, you are not them. You are you. You are a person. You need personalized treatment.
Get your facts checked.
Yeah.
One word that defines motherhood. What do you see now?
Unconditional love.
Yeah.
Giving.
True.
You forget everything. True. You just want to give.
Yeah. True, ma'am. Giving. One word that defines hope, ma'am.
Genesis.
Genesis. That's very well said, ma'am. Very well said. Genesis. So, ma'am, do fertility specialists carry emotional attachment to successful pregnancies?
Shouldn't. Because if you carry your emotion to success, then you'll carry your depression with negative pregnancy. You did your job. When we say ask patients to have when we ask patients to have realistic expectations, we should apply the same to ourselves.
Yeah, true, ma'am. This is again very well said, ma'am. This point. I mean, success ki ento own cheskuntamo, failure ki ento own cheskuntamo anukunnappudu, both are
Yeah.
same.
Yeah. Like sometimes when patients come and the family anta వచ్చేసి మీరు దేవత అదంటే నేను ఇదే అంటాను. పాజిటివ్ వచ్చింది దేవత అంటున్నారు, నెగిటివ్ వస్తే దయ్యం అనేవాళ్ళు. నేను దయ్యం కాదు, దేవత కాదు, I'm a fertility specialist. I'm very fortunate and happy that you have the good news, but you don't need to be very indebted to me or anything. I did my job and it worked out.
You've reached that sthita pragnita level. A level can pair, ma'am. Have patients ever named babies after you, ma'am?
No, but no, I don't think they named after me, but they asked me to name their baby.
Okay.
Yeah.
Okay.
చాలా కష్టం అనిపిస్తుంది. అసలు వాడు పుట్టిన పెరిగిన తర్వాత తిట్టుకుంటాడో అని, వాడికి ఆ పేరు ఇష్టం ఉంటుందో లేదో. They're asking me to name the baby.
True. I think they'll remember the story. How he was born, that story. Yeah. Has any patient success story stayed in your heart, like for a long time, ma'am?
A lot, like how many ever stories I said. I do remember more than the story, the people behind it. Yeah, there was one lady who was married for 8 years. So this is the uterus. She had a very big fibroid.
Oh, okay.
Laparoscopy, I did the surgery, and I told her that place needs to heal, and the pregnancy uterus can't grow. So give a break of 6 months, and then I'll tell you when you're ready after checking on the 3D scan. And then she comes for a 2 months checkup. She's pregnant. What did you do?
Again, this is an interesting thing for the audience also, ma'am. Fibroids, PCOS, these are very misunderstood things.
Yeah.
I don't think pregnant avadam కష్టం అనుకుంటా.
అట్లా ఎక్కడ ఉంటది అనేది చూసుకుని, సో ఇప్పుడు ఏంటంటే నాకు మిక్స్డ్ ఎమోషన్స్. షీస్ ప్రెగ్నెంట్ అని సంతోషము, అయ్యో యూట్రస్ ఇంకా హీల్ కాలేదని టెన్షన్. అండ్ దెన్ ఐ ఆస్క్డ్ her, why, what happened? I asked you to use contraception. She said 8 years I didn't get pregnant. I didn't guess that I can get pregnant. She was overwhelmed that she's pregnant, and I was thinking of the medical complications.
Oh, what happened, ma'am? Ultimately that pregnant
everything went well. Okay. Everything went well, and then where the scar was, like uterus is like 1 to 1.5 centimeters, and exactly where I operated was like 2 millimeters when she was 9 months pregnant. So I carefully monitored her, and I don't do deliveries, but where I handed over, then she came back running saying that doctor is very scared of doing my delivery if something goes wrong. I said okay, I'll come and deliver. So mother is fine, baby is fine. Happy ending.
In such scenarios, ma'am, have you ever prayed for that patient's thing to go on uneventfully?
I do.
You do. You do for all your patients.
I do every single surgery before putting the knife. Without praying God, I don't start. Yeah. And every single day when I walk into the clinic, I pray God, and then and always pray for them. Yeah.
Does society put unfair pressure on doctors for IVF success rates, ma'am?
Again, you take it or you don't take it. Yeah. You honestly know what the success rate is. You honestly give the success rate.
As long as you're
don't
honest
take pressure
in your work.
Be honest, be transparent. Nobody can give you pressure if you don't take it. Yeah.
I think educating the non-medicals or people who don't know the subject is important, ma'am, because then they'll not put pressure.
Very important. Yeah. Like I had to face this transparency thing when I came back to India. Basically, I'm a person like this where I want transparent, honest, and straightforward. Simple things like you can take leave, but you have to inform. Staff struggle to understand. Chapakunda dumma kottali kada cheppetla dumma kodtamu. Transparency is very important. I'll use my work around and telling the success rate to the patient. Like you asked me, will the patients not run away? The coordinators in the beginning, they used to think, adenti 20% success cheptaru madam, patient enduku vastadi. I'll tell whatever is their success rate. I don't mind. I have no falsification, no wrong information, no building up wrong hopes. Transparency is a bliss.
Transparency.
Yeah. And you don't need to remember what you said. You just need to remember the fact.
Yeah. That is easy.
So easy. So easy.
Correct, ma'am. 100 మంది patients ని చూస్తున్నప్పుడు అందరికీ ఒకటి అబద్ధం చెప్పి ఎన్ని గుర్తుపెట్టుకుంటారు. It's always good to be transparent and you follow that.
I follow that.
What do people misunderstand most about fertility specialists, ma'am?
Rather than a specialist, I'll talk about fertility center. Fertility center అనగానే IVF అనుకుంటారు. Fertility is pregnancy, giving them a baby. They have to understand it's not about doing them IVF, it's about giving them a baby. That's something very, very misunderstood. Yeah, fertility center అనగానే IVF అనుకుంటారు.
Ma'am, what is that one message you would like to give couples silently struggling with infertility today?
Open up.
Genesis.
Open up.
Yeah, open up.
Open up. Speak to friends, first see a good doctor, speak to friends, and speak to each other.
Open up.
And most often it's the fear of నాది తప్ప నీది తప్ప. Again, it's a joint work. You don't need to think about everything tappu. You both want to have a child together, speak to each other, correct whatever is needed. And things like losing weight or exercise, doing together, that's like joint activity where they can spend time with each other. They open up. Yeah.
True, ma'am. What is more important during fertility treatment, ma'am? Science or hope?
Both.
It goes hand in hand.
Science will give you a map. Hope will make you walk on the route to reach the destination.
Very
Both
well
are
said.
equally important.
Beautifully put up, ma'am. If there's one thing society should change about infertility conversations, what would it be, ma'am?
Don't see it as a mistake. See it as, I won't call it a disease, but see it as a medical problem which has to be resolved. Yeah.
True. What does parenthood truly mean to you personally, ma'am?
Giving. It's absolute bliss.
Yeah, this is the out of audience curiosity I'm asking, ma'am. At what age did you have your children, ma'am?
So I was 21 when I had my daughter.
Okay.
I was 27 when I had my son.
Yeah. So what you are advising is already you followed that, and then that's why you are.
See, when I got married in undergrad after second year, and then at that point of time, having a kid as an undergrad student was very early. But by the time I started doing post-graduation, everybody was either getting married or being pregnant. I had an easy job. I already had 2 children and they were growing up. Yeah.
True. I think that made your career also easy now. They're already grown up.
Absolutely amazing husband who supports my career and growth and how much ever time I want to give to my
This breaks another myth also, ma'am, about women now currently in present days. Settle ayyaka pillalni kandam lekapothe career break vastundi anukune vallaki ma'am is a live example andi. Ma'am has both hand in hand iddaru pillalni chuskuntu personal life chuskuntu. For the people who don't know, ma'am is so much into other extracurricular activities. Himalayan terrain trekking ki, Italy lo trekking ki, scuba diving ki ellaru, and I mean ma'am does so many extracurricular happy fun things apart from just regularly whatever the regular thing ma'am does, seeing patients ari kakunda. And what all, ma'am, you have done many more things now, ma'am, apart from this.
I enjoy working. I enjoy holidaying. 100% work, 100%. So when I'm at work, I'm be present. I give everything of me to do the work. But when off on a holiday, I enjoy being there. Yeah. So
really nice.
Yeah, I'm not caught up between both. Whatever I'm doing, I'm doing. Yeah.
Men usually do these things, no, ma'am. ఇంట్లో ఉండి ఫోన్స్ మాట్లాడడము లేకపోతే వర్క్ ప్లేస్ లో ఉంటూ ఇదేదైనా ఆలోచించడం. కానీ ఐ మీన్ యు ఆర్ సెట్టింగ్ అప్ అ వెరీ గుడ్ ఎగ్జాంపుల్ దట్ ఇలా చేయొచ్చు, ఇలా ఉండొచ్చు అని చెప్పి.
No, if I'm at present both. If I'm at home and I choose to work, I work. If I choose not to work, I don't work. I make the choice.
It's very inspiring, ma'am, again. Because you take time to educate your patients, people around, not your patients, anybody also. Instagram page untundandi madam ki regular ga educate chestu untaru for the people who are interested in conceiving and to have plans about taking fertility treatment. వాళ్ళకి సంబంధించినవి కూడా కొన్ని చిన్న reels లో పెడుతూ ఎడ్యుకేట్ చేస్తూ ఉంటారు ఇన్స్టా పేజ్ లో. I mean you will take time for all these things also, no, ma'am. I mean that is really very appreciable thing and inspiring thing for all the younger generation doctors.
And most of the information I give on Instagram are the patients from my clinic. It's about what I see, what they need and all. Because initially when I wanted to talk about infertility is a very small subject. How long will I have the content anbichindi? But there's so much content, there's so many stories. I always have a list of 10 to 15 topics I need to talk about, different patient stories and what we did or what they had to go through.
Because every journey is different.
Every journey is different.
A message to women or couples who failed multiple IVF treatments and opted to still stay without kids. What is your message to them?
Choice. If that's what they want, that's what they want. If as long as they both together come to agreement with that and don't look back.
True.
Like don't turn back 5 years later thinking I regret my decision. Just take time to make the decision, but stick to it.
Ma'am, your message to the parents or in-laws or spouses who divorce for not having kids.
I find it really disheartening because why do you get married to be with that person? పిల్లలు కాకపోతే ఆమెను ఎట్లా వదిలేస్తారు? పిల్లలు కదా వదలాలి. And then what happens when you have kids? No disrespect, or I'm not complaining about kids, but they'll have to find their own way and then fly away, isn't it?
True.
తర్వాత వెళ్ళిపోయే వాళ్ళని కోసం అని మధ్యలో జీవితాంతం ఉండే వాళ్ళని ఎట్లా వదిలేస్తారో అర్థం కాదు.
This is another take again, different perspective that you're sharing with the audience today.
Yes, see, who accompanies you all your life, so many years, only your spouse will understand all your nuances or the company and everything. Kids are a part of your life. Kids are not life. it's lovely to have kids, but it doesn't mean that you leave your spouse because she can't have kids or he can't have kids.
True, ma'am.
Leave it for different reasons if you have incompatibility, but not just for kids.
Yeah, not just for kids.
Yeah.
That is not the reason to do this. True, ma'am. So, I think that we covered pretty much of this, ma'am, but still, there is still so much to be asked and to learn from you. I mean, on a different various levels, various subjects, everybody will come with some or the other different problem in them, or PCOS or organic unicornate uterus of which but addressing them personally, you're doing an amazing job with all your expertise and all also. For all the work you have done, ma'am, it's very honored that you're sharing all those insights with us today, and also you've received many awards. You've been felicitated by Vaishya Limelight Award in January 2024 as the Doctor of the Year in the year 2023, and the Times Group in the year 2019 Best Emerging Clinic, and also top 5 IVF centers in India and top 5 IVF consultants in India, and also as inspiring gynecologist in Hyderabad, and not only in Hyderabad but also in whole of South India by ET Health World in the year 2019, and also as 10 most promising healthcare providers in the year 2019 given by Silicon India. So I think you deserve more, ma'am, much more to come, because doctors with a heart definitely need to flourish a lot more, and you being so close in Hyderabad among us is definitely a blessing to all the couples who are trying to get pregnant, so that very approachable, very reachable area lo meer undadamu, and also it's a blessing to all the people here and the patients here, and also, ma'am, your interest in educating, to coming and sharing your insights with us today. We are very thankful to you, ma'am. Thank you so much for sharing your insights, and thank you so much for spending your time with us today. And I hope audience meeku evaina doubts unna gan kuda mem inka cheppaleni cover cheyaleni chaala untayi, you can go see ma'am. So the Genesis Fertility and Laparoscopy Clinic andi, it's there in Kottapet, and it's also there in Sainikpuri, and it's also there in Kajaguda. Ma'am, recent ga mali
we are coming up with a new branch in Kondapur next
Kondapur
month.
also. Ma'am is also available in Kondapur shortly. So I think ma'am is a very approachable person, and apart from fertility clinic kakunda meeru inkedana issue unna gangude, she's a very very giving person. Whatever is in her perspective, she will try to help you out in a most genuine way, honest way, authentic way. So I think that we are concluding with that, ma'am. Thank you so much for your time, and thank you so much for being here with us today, ma'am. And audience, thank you so much for your valuable time. Thank you for watching. Thank you.